Well, tonight the high school gridiron is in full swing. Football players across Central Illinois are taking to the field. Their minds may be on the game, but for the coaches and parents, safety is a top concern. Joining me now, we have Dr. Marco Boscolo, an athletic trainer with Gibson Area Hospital, therapy services, and sports medicine. Great to have you back.
Thank you.
All right, so football is in full swing, and one of the major concerns, concussions. What do we need to know about recognizing them and treating them?
Concussions they've always been around. We just know more about them now, and so we got to make sure we recognize them. It's very important that we recognize concussions. We can't necessarily prevent concussions. I mean, you can practice good technique, which is important, but it's really about recognizing when they happen.
And how can you recognize, what are things we need to be looking out for?
Well, you can kind of see some hits are bigger than others, but sometimes you don't see those injuries on the sidelines necessarily, and they need to be reported. So you're looking for maybe somebody's dizzy, or sometimes they're reporting that they're not feeling right. Sometimes they can get a little emotional because they're out of whack, they don't feel the same. And that's usually at the immediate time of the injury. Okay. But you also can look at is days after, if they're not seeming to be the same person, their sensitivity to light. Those are things you're going to be looking for.
All right, we've got the Concussion Hub webpage up right now, and that's a very, reliable resource and valuable for parents and coaches and players.
Yes, it's a nice place where you can get really simple concussion information to help you understand what concussions are and where you can get resources and what things you can do to help treat concussions and how to contact your primary care provider and say, hey, I need to get checked out.
Okay, so now I remember growing up, if you hit your head, Mom was like, nope, you can't go to sleep, you gotta stay awake. Is that still the case?
No, it isn't. And some people, when I say no, they're like, wait a minute, that's what we have to do.
Right.
No, it's more about, right now, you can get rest. No, immediately we check to make sure that there's nothing major going on in the brain. Once we kind of feel comfortable that there's nothing major, it is a concussion, which is still a major injury, but we can go to sleep. And rest is probably the best treatment for concussions right now that we know. Getting rest, getting a good night's sleep, and resting can be also rest from homework. You might need a little time off from homework and school depending on your signs and symptoms.
So what else besides rest? Just like some Tylenol, ibuprofen, ice it?
Unless your doctor recommends, I would stay away from the medication. Can mask symptoms, but if you feel like you need to, maybe Tylenol might be a choice. But really talk to your healthcare provider or athletic trainer you're working with. And getting rest, getting sleep, getting your food, trying to stay away from TV and texting as well.
Oh, texting. Good call there. So what kind of recovery time are we looking at with a concussion?
It's recommended. It usually will find for young athletes being from 14 to 18 usually take longer to heal than a professional football player. So that it takes a longer period of time, usually be about a week to 3 weeks to recover. But it really depends on your specific case and how long it will take.
Yeah, now how should parents or coaches or even teammates respond to, a concussion or the warning signs?
They should have them evaluated. You should pull them out of play until you're absolutely certain there's not a concussion, there's something else going on. But they've probably been around enough to recognize that something's going on, they need to sit, no more contact, because you're really afraid of a second impact syndrome, and that can cause some serious injury and possibly death.
Yeah, so just make sure you report it.
Yes.
And who should you report it to exactly?
Report it to your athletic trainer. We have at Gibson Area Hospital, we have 6 schools in the area that we provide athletic training services to, and we have a physician assistant and athletic trainers that are on the sideline working with the athletes, and we're there to assess them and make sure they get the best care possible.
All right, lots of valuable information. Not that we want anyone to get concussions, but definitely valuable information if you happen to get one. If you need any more information on Gibson Area Hospital and all the services that they provide, you can go to CILiving.tv. We'll be right back.